Hello, my name is Alejandro Añoveros, and I will be showing you the proper way to take a 7-site skinfold measurement. The equipment that you will be needing today is a caliper. There are a couple different kinds of them. The caliper should be calibrated to about 12 grams per millimeter squared. Now, the person you are measuring should be wearing loose-fitting clothes or sports clothes. We will be measuring the upper body, so the client or patient will be needing to take off their shirt. For women, they can wear a sports bra. Now, all measurements have to be taken on the right side of their body, whether it's in front or back. A quick list of sites are chest, mid-axillary, triceps, subscapular, abdominal, suprailiac, and thigh. You do not need to go in a specific order, but you want to try and rotate around the sites. When taking skinfold measurements, the caliper should be placed about 1 centimeter away from your thumb and finger, perpendicular to the fold, and halfway between the crest and the base of the fold. You will need to keep pinching while you're taking the reading. When you place the caliper on the skinfold, wait 1 to 2 seconds before you take a reading, no longer than that. To get a proper reading, you will need to take a measurements at least twice and then average them. If by chance the measurements are not within 1 to 2 millimeters, then you will have to retake the measurement. First side, I'll begin with the tricep. The subject's arm has to be relaxed and at their side. It's a vertical fold on the posterior midline of the upper arm. It has to be halfway between the acromion and the olecranon process. The second will be subscapular. This is a diagonal fold in line with the angle of the iliac crest. It is basically parallel to the scapula. If it helps, have the subject fold his arm behind so that the iliac crest can be seen and felt easier. Then, when you found the spot, have the subject return his arm into resting position and then take the measurement. The third will be the mid-axillary. Have the subject put their arm across their chest and hold on to their opposite shoulder. This will make it easier to take the reading. This will be a vertical fold on the mid-axillary line at the same level of the exnoid process of the sternum. The fourth is the chest or pectoral. Have the subject relax their arm. This is a diagonal fold, 1/2 the distance between the anti-axillary line and the nipple for a man, and 1/3 the distance for a woman. The fifth will be the suprailiac fold. This is a diagonal fold in line with the natural angle of the iliac crest. The sixth is the abdominal fold. This is a vertical fold 2 centimeters to the right side of the belly button. The seventh and last fold is the thigh. Have the subject put their weight on their left foot and slightly bend their right knee with only their right toe touching the floor. This will cause the right thigh muscle to relax. This is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease of the hip. Now that all measurements have been taken, you will then use them to find body density by plugging them into these formulas. After you obtain body density, you will then need to plug them into one of these formulas to obtain body percent fat. Both equations assume a slight different density of fat mass. Now, factors that may contribute to the measurement errors are poor technique and an inexperienced evaluator. Also, being extremely obese or extremely lean, and if the caliper is not calibrated properly, will cause errors in measurement.